So we've got a really painful little lesion on the forefoot of a patient here. Now we've done this one a few times before, so we pretty much know what to expect under here, but it doesn't actually look like much on the surface, but you can see it's got this really thick callus cap. And this one, usually we debride the callus cap and there's a little corn underneath here, and it's a really concentrated section of hard skin. And this one gets particularly painful to walk on. Now this is the primary reason this patient comes into the clinic to get this one removed. It's really painful to walk on, really easy removed, and she gets relief from this for about 8 weeks, and then at about that 9 or 10 weeks it gets really painful to walk on. So she comes in and gets it trimmed out. Now this of course is caused like any other corn by pressure. So if the pressure causes the skin to harden and the hard skin causes more pressure, it keeps going around that positive reinforcing loop and you get this corn or hallumidurum form. So we're removing this here with a 15 blade, and we're just gently going around the border between the living and the dead skin. We don't often get blood, but sometimes you do get a little bit of blood with this, and it's not painful to perform. So we don't need any anesthetic or any freezing or anything like that. And it's already dead skin, so there's no point freezing it or anything like that, because it just won't fall out because it's already dead. And it's attached to the living skin. So the whole point of this is to basically relieve the pain for the patient and try and give them some longer lasting relief. We put insoles to cushion this, take some weight in the arch. You can see the corn there. It's really like a little hard piece. It's really a similar hardness to rice. And then we go and sort of remove all those edges so that it's more like the edges aren't as vertical, so it doesn't grow back as quickly. And that's what it looks like in close up. So we'll see this patient again in probably about 6 to 8, maybe even 10 weeks' time.